Trauma and cardiovascular health. Understanding the link and mitigating risks. Trauma can have far-reaching effects on physical health, including significant impacts on cardiovascular health. Understanding the connection between trauma and cardiovascular issues is crucial for developing preventative measures and treatments to mitigate these risks. This video investigates the link between trauma and cardiovascular health issues and discusses preventative measures and treatments to support heart health in trauma survivors. The link between trauma and cardiovascular health. Stress response and heart health. Trauma triggers a stress response in the body, leading to the release of stress hormones such as cortisol and adrenaline. While these hormones are vital for immediate survival, chronic activation due to prolonged trauma or stress can negatively impact heart health, increasing the risk of hypertension, heart disease, and other cardiovascular conditions. The chronic stress response can lead to wear and tear on the cardiovascular system, contributing to the development of cardiovascular diseases. Inflammation. Chronic stress and trauma can lead to persistent inflammation in the body. Inflammation plays a significant role in the development of cardiovascular diseases, including atherosclerosis, the buildup of plaque in the arteries, which can lead to heart attacks and strokes. The inflammatory response can damage blood vessels and promote the formation of plaques, increasing the risk of cardiovascular events. Autonomic nervous system dysregulation. Trauma can disrupt the autonomic nervous system, which controls involuntary bodily functions such as heart rate and blood pressure. Dysregulation of this system can lead to increased heart rate variability, hypertension, and other cardiovascular issues. The imbalance between the sympathetic and parasympathetic branches of the autonomic nervous system can result in chronic cardiovascular stress. Behavioral factors. Trauma can also influence behaviors that impact cardiovascular health. For example, trauma survivors may engage in unhealthy coping mechanisms such as smoking, excessive alcohol consumption, or poor dietary habits, which can further increase the risk of cardiovascular problems. Addressing these behavioral factors is crucial for comprehensive cardiovascular care. Studies on trauma and cardiovascular health. Increased risk of cardiovascular disease. Research published in MedExpress has shown that individuals with a history of trauma are at a higher risk of developing cardiovascular diseases. Studies have found that trauma survivors have higher rates of hypertension, heart disease, and stroke compared to those without a history of trauma. The cumulative effect of trauma and chronic stress can significantly impact cardiovascular health. Inflammation and heart disease. A study highlighted in GradCoach examined the link between trauma, chronic inflammation, and heart disease. The research indicated that individuals with trauma-related stress exhibited higher levels of inflammatory markers, which were associated with an increased risk of cardiovascular conditions. These findings highlight the role of inflammation as a mediator between trauma and cardiovascular health. Autonomic nervous system and cardiovascular health. Research has also found that trauma can lead to autonomic nervous system dysregulation. A study published in MedExpress revealed that trauma survivors had altered heart rate variability and blood pressure regulation, contributing to cardiovascular health issues. Addressing autonomic dysregulation can improve cardiovascular outcomes for trauma survivors. Case studies. Case studies illustrate the impact of trauma on cardiovascular health and the benefits of targeted interventions. One case involves a trauma survivor with severe hypertension and heart palpitations. Through a combination of stress management techniques, physical activity, and medical interventions, the individual's cardiovascular health improved. Another case highlights an individual with a history of childhood trauma who developed heart disease. Behavioral therapies and lifestyle changes helped reduce cardiovascular risks and enhance overall health. Preventative measures and treatments. Stress management. Effective stress management techniques can help reduce the impact of trauma on cardiovascular health. Practices such as mindfulness meditation, deep breathing exercises, and progressive muscle relaxation can lower stress levels and promote heart health. These techniques can reduce the physiological stress response and improve cardiovascular function. Physical activity. Regular physical activity is crucial for maintaining cardiovascular health. Exercise can help reduce inflammation, improve heart rate variability, and lower blood pressure. Activities such as walking, jogging, swimming, and yoga can provide cardiovascular benefits and enhance overall well-being. Consistent physical activity can strengthen the heart and improve circulation. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can support heart health. Nutrients such as omega-3 fatty acids, antioxidants, and fiber can help reduce inflammation and protect against cardiovascular disease. A heart-healthy diet can lower cholesterol levels, reduce blood pressure, and promote overall cardiovascular health. Medical interventions. For trauma survivors with significant cardiovascular risks, medical interventions may be necessary. These can include medications to manage hypertension, cholesterol levels, and other heart-related conditions. Regular checkups with a healthcare provider are essential for monitoring cardiovascular health and managing risk factors. Medical interventions should be combined with lifestyle changes for optimal outcomes. Behavioral therapies. Therapies such as cognitive behavioral therapy, CBT, and trauma-focused therapy can help individuals develop healthier coping mechanisms and reduce behaviors that negatively impact cardiovascular health. Addressing the psychological aspects of trauma is crucial for comprehensive cardiovascular care. Behavioral therapies can provide strategies for managing stress, improving mental health, and enhancing overall well-being. Trauma can significantly impact cardiovascular health, increasing the risk of hypertension, heart disease, and other cardiovascular conditions. Understanding the link between trauma and cardiovascular health is essential for developing preventative measures and treatments to mitigate these risks. By incorporating stress management techniques, regular physical activity, a healthy diet, medical interventions, and behavioral therapies, trauma survivors can support their heart health and reduce the risk of cardiovascular issues. Ongoing research continues to provide insights into the connection between trauma and heart health, offering hope for more effective interventions and improved health outcomes for trauma survivors. Addressing cardiovascular health in trauma survivors with a comprehensive, multifaceted approach can promote long-term well-being and resilience.